To give you some background on this assignment, which will be your application of the essential services of public health to the COVID pandemic within the United States, let's look at the core functions. So within public health, there are three core functions: assessment, policy development, and assurance. So with assessment, this addresses using data, surveilling how the data is changing, identifying health problems within populations or specific groups. So identifying the problem in terms of PERI. We then have policy development, and this is where we use the data to develop policies and strategies to solve the problem. And then assurances has to do with evaluating those policies to make sure that they're being effective. So let's now move into the essential services, because this is what you'll be addressing with your project. Again, you can see that there's assessment, policy development, and assurances. And then assessment is broken down into monitoring health and diagnosing disease. These two areas were covered in greater detail on the previous video, so I won't talk about this anymore. But the point is that for this assignment, you need to find evidence of what was done for COVID for these areas. For policy development, we have three different services. The first two, again, were addressed. So let's go on down to the third one, which is develop policies. So with policy development, we need to develop policies. We need to have a plan that supports the community's health. So you'll need to look at COVID and what policies were actually developed. We're in the middle of the implementation of those policies. So depending upon the level, you can find out what they are and then identify them and present them. All right, assurances. There are four different services under insurances. The first one is enforce laws and regulations to protect the health and ensure safety. So if you have a policy, you have to have some mechanism for enforcement. So you'll need to look at COVID to find out what was or wasn't done, and then comment on its effectiveness. The next one is linking people to the needed personal health services and assure the provision of health care when otherwise unavailable. So what was done to link people to services? It doesn't have to be only medical. So let's find out what kinds of linkages were created to address COVID. And then the next one is assurances in terms of a competent workforce. So look to see what measures were taken to assure that we had sufficient healthcare workers, sufficient first responders to address the COVID crisis. Also, it might be things like resources, hospital beds, ventilators, those sorts of things. The next one is evaluate. This has to do with evaluating the effectiveness, accessibility, and quality of personnel and population-based health services. So what was done to evaluate that we had enough respirators, that we had enough clinicians? And then research has to do with researching to find new and innovative solutions to the problem. So with your project, I want you to look at the different levels, or actually the level that you've been assigned, and then just find evidence in terms of how we addressed the essential service related to COVID-19. And I'm guessing you will find things that worked and things that didn't work. Please comment on that. This is your chance to, I want to say, have some fun and apply what we're learning to the COVID-19 pandemic. Please let me know if you have any questions.